Hello, everybody. Hello and welcome. And thank you for joining Children's Healthcare Canada for our Vaccination Conversations pop-up. My name is Corey Forche, Project Manager of the Immunizing Children with Confidence program at Children's Healthcare Canada. And this pop-up, like all our pop-ups, are deep dives into a specific subject. Today's case, vaccine delivery and communication relating to the COVID-19 vaccine for children aged 5 to 11. Although the skills you'll learn today will be applicable to all vaccines and for children and youth. This work is being led by our Immunizing Children with Confidence project, but I want to take a moment to thank today's generous sponsors and partners, the Public Health Agency of Canada through the Immunization Partnership Fund, our co-host, Stollery Children's Hospital, along with Stollery Children's Hospital Foundation and Alberta Health Services, and of course, our collaborating partners, Solution for Kids in Pain, SKIP. Before we begin, it's important to recognize that Children's Healthcare Canada acknowledges our offices, located in Ottawa, are on the unceded, unsurrendered territory of the Algonquin Anishinaabe people. We recognize and deeply appreciate their historic connections to this place. We also recognize the contributions that Métis, Inuit, and other Indigenous peoples have made, both in shaping and strengthening this community, our province, and the country. We invite you to take a moment to consider the treaty lands you may be located on, and feel free to type a land acknowledgement of your own in the chat if you'd like. Today's event will provide healthcare professionals like yourselves with the skills, tools, and information necessary to confidently promote and provide vaccinations to children and their family. Today's topics include preventing needle fear and pain, tips to set up your vaccination clinic, an up-to-date review of the current science around COVID and vaccines, and how to communicate or counsel vaccine-hesitant families. The day's events will be held on this Zoom platform. We encourage you to engage in the chat to network, ask questions, and share ideas. We recognize there is significant expertise from all of our attendees as well, and hope you will engage respectfully and share knowledge on this platform. However, anyone engaging in abusive dialogue or sharing misinformation will be removed. Our morning sessions will focus on the vaccinator experience and highlight pain management and needle fear. However, our afternoon sessions will provide a great overview of both the current science and how to communicate that science and counsel vaccine-hesitant families. For both the morning and afternoon sessions, we will hear from all of our presenters, and then we'll bring them together for a joint Q&A. We encourage you to ask questions in the chat as you think of them, both during the presentations and during the Q&As. We'll make sure to monitor that chat so our moderator can share your questions and comments with the panelists. Another quick note that there will be a couple of polls posted throughout the day, and a brief survey will be sent afterwards. We really appreciate if you can participate in these surveys. They're really critical in evaluating and improving events like these, and also our larger programs like Immunizing Children with Confidence, to ensure that we can create products and events of value. Now, before we kick off the day, Minister of Health, Jean-Yves Duclos, has recorded a short video message for us, which we'll play now.
Hello, everyone. A COVID-19 vaccine has been approved for kids 5 to 11. Every new vaccine goes through a rigorous approval process to ensure its safety and efficacy. Now that we have a safe and effective pediatric vaccine, we are reaching a major milestone in our fight against this virus. I know this is a big relief to many parents and that many children have already received their first dose. Congratulations! Some may still have a few questions, and that's okay. This is an important decision for your child and for your entire family. As parents, and I'm one of them, we all want to make an informed decision, equipped with the very latest evidence-based information. And that's why this event, which brings together some of Canada's leading experts, is so important. 3 Canadian non-profits, Science Up First, Children's Healthcare Canada, and the Sandbox Project, are teaming up to help make sure everyone has access to reliable information. On Kids and Vaccines Day, I encourage everyone to take part and learn more about pediatric COVID-19 vaccination. A final word, vaccination is our best defense against this virus. If you haven't already done so, I encourage you to roll up your sleeves and get that shot.
We thank Minister Duclos for those kind words and support of the day. We encourage you throughout the day to post any thoughts or comments you may have on social media using the hashtag KidsVaccinesDay, as we create a national movement to promote safe and effective vaccines for our children. To answer children's questions directly, we have invited another prominent Canadian to join us. Dr. Teresa Tam has helped answer some short kids' questions in a new resource that we're co-developing.
Hi, Dr. Tam. My name is Gavin, and I'm turning 12 soon. I'm due for my second vaccine. Should I get the kids' vaccine or the adult vaccine?
So thank you very much, Gavin, for your question, and thank you for getting your first dose. And I hope you have a great 12th birthday. That's a great question. So we have a great team of experts, including pediatricians. So these are kids doctors from across Canada who reviewed the latest research on vaccines. And what we're recommending for kids who are due for their second dose after turning 12 is that you should get the adult dose for your second shot. The pediatric or kid vaccine has a smaller dose than the one used for teens and adults, but both vaccines work very well with the immune system and offer great protection against being very sick with COVID-19. If you happen to get the lower shot, don't worry, it will still work well to protect you and will count as your second dose. So you should always ask these great questions or any other questions you have at the time that you get your vaccine. And it's important to ask questions if you're not sure about anything related to your health. So thank you for your question.
Bonjour, moi je m'appelle Evelyne, puis moi j'ai 6 ans. Puis ma question c'est, si je prends mon vaccin, est-ce que ça va aider à faire fin notre pandémie? Je suis tellement hâte à aller à l'école avec pas de masque.
Merci beaucoup pour cette question, Evelyne. Tu n'es certainement pas le seul à vouloir que la pandémie se termine rapidement. Les vaccins sont une des choses les plus importantes qu'on peut faire en ce moment pour se protéger et pour éviter de devenir malade avec la COVID-19. Il y a aussi d'autres gestes qu'on peut prendre pour protéger nos amis, les autres élèves et les professeurs à l'école, même après avoir été vacciné. Par exemple, lorsqu'on se trouve dans les endroits avec des personnes avec qui on ne vit pas, surtout à l'intérieur, un masque bien ajusté reste un bon moyen de se protéger et de protéger les autres. On travaille tous pour se protéger l'un des autres. C'est vraiment un travail en équipe. La pandémie de COVID-19 dure depuis longtemps. On ne sait pas quand elle sera terminée pour demain, mais j'ai beaucoup d'espoir en l'avenir. Merci beaucoup pour cette question.
We thank Dr. Tam for her amazing answers to these children's questions. You'll see more of these videos released in the coming weeks and months. We know families are looking for helpful and trustworthy resources when making the decisions to vaccinate their children. It's important for parents to have answers to the questions their children are asking, and these videos will be one tool and resource that can help grow the confidence of both children and parents, as families can watch them together prior to a vaccination appointment. So thank you. Thank you all for your attendance. I will now pass the torch to our amazing Stollery Children's Hospital keynote speakers, Dr. Ali and Dr. Kammer. Dr. Ali is a pediatric emergency physician at the Stollery Children's Hospital and a professor of pediatrics and emergency medicine at the University of Alberta. Dr. Kammer is a knowledge broker for the National Knowledge Mobilization Network Solution for Kids in Pain, SKIP, and is also based at the Stollery Children's Hospital and departments at pediatrics at the University of Alberta. I'm very excited for their presentation. Needles and robots and prizes, oh my, better experiences mean more vaccinated children. Doctors Ali and Kammer, over to you.
Thank you so much, everyone. We're very excited to be here today and share some of the learnings that we've had over the past couple of years and the past decades for myself as a pediatrician, a pediatric emergency physician. So we, in the spirit of children and children's books, our talk is Needles and Robots and Prizes, oh my. And the goal is to create better experiences for children and their families, because we know better experiences mean more vaccinated children. Next slide, please. So we'll talk about a few things today. We'll talk about and try to understand how needle pain and distress affect vaccination rates, how they connect directly. We'll then really do a deep dive with Dr. Kammer into evidence-based strategies to manage children's needle pain and distress. and then a little bit about how to, throughout the talk, and then a focus with some resources at the end on how to implement these strategies to improve children's immunization experiences. Next slide. So where does this all start? It starts with vaccines. We're here today because we care about vaccines. Vaccines work. We know that the more people in a community who are vaccinated, the harder it is for a disease to spread. In the simplest of terms, if you encounter someone who is ill with an infectious disease and you are vaccinated against it, your chances go down significantly. This little PHAC graphic from a number of years ago is a really great illustration. We look at some of the common diseases. When I've got enough grays that I remember when some of these were still active, and concerns when children came into the emergency department. Whooping cough, which is pertussis. Prior to the vaccine inception, there were up to almost 20,000 cases per year in Canada. After the vaccine, this is one of those tricky ones, though we still have some trouble with this one, but we're still down 93%, and pertussis outbreaks are dramatically decreased. Measles, chickenpox, mumps, virtually eliminated, and diphtheria and polio in Canada essentially unheard of in recent years. The data in the yellow part is from 2013, but not very different in 2022. Next slide, please. So what about the COVID vaccine? Because this one came up quickly, it caught people off guard. It felt like the research was being produced really rapidly, and it made people nervous to accept something brand new. So first, to put into perspective, this research began 20 years before we ever saw this vaccine, because when we had our first SARS pandemic in the early 2000s, which again, maybe I'm giving away too much about my age, but I remember at that time, they were already developing this vaccine. And then they put a pin in it because it quickly resolved universally. And then when it came back, they picked up that research again. So they were building on many, many years of research already. Now, what about for our kids? This was a very recently published study just last month in the New England Journal of Medicine, which is a top tier medical journal. And this looked at teens, and they looked at almost 4,000 teenagers, of which 2,500 received the active vaccine, and there were no serious adverse events. The only adverse events they saw were pain at the injection site. That's not a big surprise, ranging from like 92 to 93% of youth, headaches in about half to 2/3 of the children, and some fatigue in about, again, half to 2/3 of the children. And that was temporary, a day or two at the most. The immune response was essentially the same as in young adults. So this was for teens, was as effective as it was for adults, and there were no cases of myocarditis or pericarditis. Of note, this study was Moderna funded, who are the makers of this particular vaccine, and I think that's important to acknowledge when we talk about research. So here we have 4,000 children studied or youth studied. That may not seem like a large number compared to the population of youth in Canada, for instance, but as a clinician researcher in pediatrics, I can tell you with great conviction that that is a giant clinical trial in pediatrics. Most clinical trials in pediatrics are 100 to 500 children if it's a very big trial. Next slide, please. What about our littler ones, our 5 to 11-year-olds? So that was our next group that has been recently approved for vaccines in Canada. And this study, published just two and a half weeks ago, had over 2,000 children, with twice as many getting the vaccine than the placebo. So if it was about 2,000, say about 14 to 1,500 got the vaccine, and 500 had the placebo. And they had the same immune response rate as the older children, the 12 to 17-year-olds. Again, there were no serious adverse events, and the vaccine efficacy at preventing COVID, even 7 days after the second dose, was 91%. 91% prevented from getting COVID. And this one was a CDC-funded study, not a drug company sponsored. Next slide, please. So what does the vaccine do for preventing critical illness? Because some people I've heard say, well, children tend not to get very sick with COVID anyways. But we do know that there is a small percent that get critically ill. And we can't predict who's going to become critically ill. So this CDC-funded study that was just published not even 2 weeks ago looked at Pfizer's effectiveness against ICU admissions and the need for life support. And both of them were 98%. And all 7 deaths that occurred in this study occurred in unvaccinated patients. So no vaccinated patients died, even if they made it to the ICU or received life support. As a parent, as a pediatrician, this is highly compelling and makes me feel really confident in the decision I made with my spouse for our family about vaccinating our teens. Next slide, please. Now, this CDC study looked at the prevention of MIS-C, or multi-system inflammatory syndrome in children. If you have not seen this, bluntly speaking, I'm a pediatric emergency physician. This is one of the scariest things I've seen in the last 2 years. These children are so sick and they deteriorate rapidly and they don't respond to the usual things we do in terms of fluid. They need very high doses of inotropes, blood supporting medications. I've got goosebumps just thinking about the last couple of kids I took care of. This Pfizer study showed that 2 doses provided 91% protection against MIS-C. And among the critically ill MIS-C patients who required life support, all were unvaccinated. So again, if you are vaccinated and you do develop MIS-C, in this study, no one required life support. So it is protective against that as well. So for me, these were very compelling reasons to vaccinate our youth. Next slide, please. So what are the current vaccination rates? And this slide is about 2 weeks old in terms of how current the data are. And in our teens, our 12 to 17s, we have about 85, well, I guess 83 plus 5, so 88% vaccinated with at least 1 dose. Most of them are fully vaccinated, 83%. And then for our younger group, we're just about at half have 1 or more doses, but fully vaccinated is still quite low at this time, given that it's been recently approved, and this is where we stand right now. So you can see there's room for improvement in these numbers. Next slide, please. So what do caregivers need to know? What do they want to know to make them feel more confident to be vaccinated? So almost 2/3 of parents want to know about potential side effects, and we have some excellent studies to help answer those questions, some of which I've just highlighted. 60+% of parents want to know about the safety of the vaccine. Again, I think we've got some really solid data for that now. And over half of the parents want to know about the effectiveness. And I think, again, we can answer those questions with quite a reasonable amount of certainty for 5 years and up now. But what are the other things they need to know to tip them over if they have any hesitancies with this vaccine? Well, almost 20% want to know about reducing needle pain, and 11%, 1 out of 10 families, want to know about reducing needle fear in their child. So this isn't even directly related to COVID per se, but those almost 20% are worried about pain and 11% about fear. And this is actually potentially holding them back from getting vaccinated. So for the remainder of our time with you this morning, Dr. Cameron and I are going to focus on those 2 pieces, the fear and the pain. Next slide, please. So up to 10% of people avoid vaccines due to needle fear. This is universal, pre-COVID, post-COVID, during COVID, it's 10% as a conservative estimate. More than 60% of children have a fear of needles, and 20 years in this profession, 25 if you include training, absolutely. This is it. I see this every single day. And up to 1/4 of parents and adults have a fear of needles as well. And this starts in childhood and extends for most of them. And then these adults, when they become caregivers and parents, can inadvertently project that on their children as well. And we see this, I see this in the emergency department. here comes the needle, and I'm just smacking my forehead going, oh dear, you've just set me up for failure now, because they're projecting their fears. So the more we can address this both at the childhood level, we decrease the likelihood of them becoming adults with this fear. And if we address it at the caregiver adult level, we then improve the chances for those children in the future as well. So these folks may not get vaccinated. They are telling us that 10% have said they are avoiding vaccines due to needle fear, even though they fully embrace and value the science and understand the value of these vaccines. Their fear is holding them back. And 10% is a significant amount in terms of achieving herd immunity in a community. When we're sitting at high 80s for teens, another 10% on top of that would achieve herd immunity for that age group, for instance. So what can we do? Next slide, please. So high levels of fear means it's going to be a very difficult experience for them. They may go on even beyond this pandemic to avoid healthcare in the future. And then they require special treatment and special services, which of course are available, but aren't universally available. Having a coping plan with the involvement of a child life specialist, having desensitization therapies for needle fears, those work, they're excellent, but they're not easily accessible. So if we can avoid the development of these fears, we can actually improve the experiences for vaccination for COVID now and into the future. So I'm going to pass the talking stick to Dr. Cameron now to guide us through the many ways we can support families through COVID vaccines and beyond.
So thank you so much, Dr. Ali. In this next part of our presentation, I'd just like to discuss some evidence-based strategies to manage pain and distress during vaccination, including providing some tips and tricks about how to implement these strategies at your site. So as you can see here, there are 5 different aspects to consider in order to improve children's vaccine experiences, and I'll be going into each one of these. So the 5 different aspects are procedural interventions, physical interventions, psychological interventions, pharmacologic interventions, and process interventions. So there are a few different things that you can do to help improve the procedure itself for kids. One of them is to know that aspiration for intramuscular vaccine injections isn't necessary, since there are no major blood vessels where your patients are getting the needle. And in fact, it can increase the pain of injection for patients of all ages. And this is because the needle will end up being in the tissues longer and there's more wiggling of the needle. The nice thing about not aspirating before injection is that it's cost neutral, yet beneficial to improving children's needle experience. And along with this recommendation is that the needle should be administered quickly within 1 or 2 seconds. The less time a needle is in the tissues, the better, the less opportunity there is for the needle to cause the child or youth any pain. And also, since it is possible to get other vaccines in addition to the COVID vaccine at the same time, it's important to give the most painful needle last in order to lessen children's distress. So since pain can escalate with each subsequent needle, if you may be giving more than 1 needle at the same time at your site, giving the most painful one last will decrease the child's level of overall distress compared to if the most painful needle was given at a different point in time. And in terms of physical interventions, it's a great idea to involve the caregiver in the procedure. For older children, even just having the caregiver put their arm around the child can help the child feel safer, more confident, and therefore less likely to experience significant distress. And regardless of whether the child wants their caregiver to put their arm around them or not, having the child stay in a sitting position will help them feel more in control. And so, although the COVID-19 vaccine is currently only available to children over the age of 5, I'd also like to just go over some physical interventions that can be useful for infants or younger children for the time that the vaccine is approved for these younger kiddos. So positioning is also important for this age group, with caregivers holding the child in their lap and providing skin-to-skin contact if possible. And the baby or child should be also sitting upright or be a little bit more upright than completely laying flat. And for babies, if the caregiver is chest feeding, this can also provide a good analgesic effect for the infant, while also providing that opportunity for comfort positioning and skin to skin. I'll get into some of the options for non-chest fed babies in the pharmacologic section, but for some of those babies, they may benefit from sucking on a pacifier during their injection. And this is the fun part where Dr. Ali and I get really excited and could go on and on for ages, but there are so many awesome ways that children and youth can be distracted when they get their vaccination. Dr. Ali is going to go into some of the directions that this research is going in near the end of the presentation, but suffice it to say, I am definitely not giving you an exhaustive list here with different psychological interventions that you can use. So as I mentioned, an effective psychological intervention to help kids and youth manage their needle pain and distress is distraction. So distraction can run the gamut from being very low cost to implement to being much more resource heavy. Cost neutral interventions can be as simple as having a conversation with the child or youth about their favorite TV show, or even just asking them to wiggle their toes during the injection. Kids and youth receiving a vaccine may want to listen to music as a distraction, or they may find it helpful to play a game or watch a video on a smartphone or tablet. And not to say it's feasible at all sites, but strategies such as having child life staff present to having therapy animals are all interesting ways that sites can help improve children's vaccine experiences. And in addition to distraction, it can be helpful to encourage the child or youth to breathe deeply. And if they wish, you can also provide a verbal signal that you're about to inject the vaccine. It also helps to use positive language with the child or youth receiving the vaccine to let them know what they did well, and that will help them feel better about the entire process when they reflect back on it later. And the pharmacologic interventions that I'm about to discuss are unfortunately not things that you'll be able to implement yourselves as healthcare providers, but things that caregivers should definitely be informed about prior to the vaccine appointment. So the first pharmacologic intervention that I'd like to mention is the use of topical anesthetic or numbing creams. Numbing creams can reduce the sensation of the needle poke, which helps make the vaccine experience more positive for the child or youth. Numbing cream can be purchased at the pharmacy, and it comes either in a tube or as patches that can be placed directly against the skin. So if a family chooses to purchase the numbing cream in a tube, they can either use Tegaderm to cover the cream until it's time for the injection, or as seen in the image here on the left, they can wrap the injection site in saran wrap. Either way, it's important that the family knows how long the numbing cream takes to work. Some creams, such as Emla, need to sit on the skin for 60 minutes, and others, such as Maxilene, only need 30. And I also mentioned before about a pharmacologic intervention for infants under 12 months of age. So even though babies in this age group aren't yet eligible for vaccination, it's important to keep the analgesic effects of sucrose or sugar water in mind. Sucrose is a great analgesic for babies who aren't chest fed, and it can be used in combination with non-nutritive sucking with a pacifier. And Dr. Taddeo in the presentation after ours is going to get into some of the process interventions in more detail during her talk, but I just wanted to take a second to introduce the concept. Process interventions are important, and they often include education surrounding pain management for vaccines. So this education includes educating clinicians about vaccine injections and pain management, educating parents before and on the day about vaccines and pain management. And for kids 3 years and older, it's really important to talk to them as well about pain management in a language that they understand. Children that are younger than about 10 years old should also have a caregiver present for their injection to help provide them with support if possible. And next, I'd just like to touch on some unique considerations for the COVID-19 vaccine. So as you may know, children with disabilities are more likely to get really ill from COVID-19, which makes vaccinating children with disabilities all the more important. For kids with disabilities, support is really key, as is having an open conversation with caregivers and the child themselves. And so families should be encouraged to request any accommodations that they need. Such accommodations can include the child getting vaccinated in a quiet room away from the hustle and bustle of the main clinic areas, or being vaccinated in a special low stimulation clinic. Even something as simple as encouraging the child and family to get up and walk around after the child's vaccine may be helpful. It's best to ask the family directly about what they need and how you can help. And also, if they're available at your site, child life specialists are a great resource, and they can help develop coping plans and other pain management strategies to help children and youth with disabilities. And I'd also just like to turn your attention to some of the issues with social inequity and COVID-19 vaccination. So with regards to the COVID-19 vaccine, caregivers from lower income households, racialized groups, and those born outside of Canada were not as likely to want their children to be vaccinated for COVID-19. So the authors of the study that I've displayed here have highlighted that there needs to be further efforts to reach out to excluded populations to promote informed vaccine decision-making. While those efforts are likely out of scope for you, I present you with this study to encourage you to be sensitive to those who may be presenting for vaccination, even if they're a bit hesitant. Be mindful of some of the issues that excluded populations have with accessing vaccines and accessing evidence-based information. And remember to educate in a fair, open way using a language that's accessible for those coming to you for the vaccine. And so with that, I'll pass it back to Dr. Ali to discuss some of the future directions in pain and distress management when it comes to the COVID-19 vaccine.
Thanks so much, Dr. Cameron. So future directions. Number one, I think, and many of those of us who care for, love, or otherwise adore babies are waiting for these vaccines to be approved for use in the youngest of our children, our precious babies. So far, the evidence is not there as yet. It is still coming. For the time being, they remain unvaccinated. And certainly from a clinical point of view, I can tell you both this population under 5 and those children who have chronic health conditions or other comorbidities are the two populations that I am seeing most in our emergency department and are the ones that we are sending most to the ICU. So I await with bated breath for this vaccine to show its effectiveness and be approved for this age group. Next slide, please. And then from turning back to our pain and distress focus, we're always looking for other ways, better ways, less expensive ways, more accessible ways to make the vaccine and in general medical procedures in children less painful and less distressing. So there are lots of things still being investigated in different settings, and we're hoping they will translate to vaccine settings as well. Some of them are the use of humanoid robot distraction, because there is something just inherently really cool about a robot, and they're not quite a daily occurrence yet. So the novelty aspect really does appeal to children. Dr. Cameron and I, our team here at the Stollery, we do robot research supported by our foundation, and boy, oh boy, it's well received. The kids love the robot. We also have virtual reality trials ongoing, and we're not the only ones. There's lots of people looking at this, trying to figure out how we can engage that immersive experience for children, because sometimes, as you can see in the little picture of the little fella looking at the iPad, they can be quite immersive, quite distracting. But for some children, even knowing that needle is coming towards you is very distressing. And so when you're immersed with, for instance, goggles that block your peripheral vision and noise input, that is actually very appealing for certain children. So we're looking at different options that might help address individual children's needs. So more personalized form of medicine for these children when they're coming in with to receive painful or distressing medical procedures. Next slide, please. And then, of course, there's information all over the place. And sometimes it's a little overwhelming to figure out where to go and where to find your sort of resources in one place. So the names you see listed on this screen, of course, Children's Healthcare Canada, Solutions for Kids in Pain. We'd also like to direct you to Immunize Canada and the MEG Foundation, which is based out of the States. All have excellent resources and have filtered and sorted and collected resources, which help make it a little bit easier to find what you're looking for. And if you scan that QR code, it will take you to a list of all these resources. So I'll just leave that up for a minute or longer in case anyone is still getting their phone to wake up to scan it. But here you will find these organizations and other resources that you might find helpful. And the last slide, please. So we'll finish up by saying we want to thank you so much for coming out. I know it's quite early for our colleagues in BC still, and getting into lunchtime for those on the East Coast. So we appreciate your time and your commitment to being here. If you wish to follow Dr. Cameron or myself on Twitter, we do tweet out about pain management, both for vaccine as well as general bettering of the pain and distress experience for children. So feel free to follow us, fire us any questions either through Twitter, through our talk, through the question and answer panel we're going to have shortly. Thanks so much for your time.